Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms, and every month we bring to you an important health series from our friends at UTMB Health, and they are a preferred provider for the Bay Area, Galveston, League City, all you Southeast people down there. UTMB Health is our preferred provider for you. And this month we are bringing you all things puberty and adolescence, and really just diving in with two health professionals with us here today, because it's such a broad topic. So thank you, ladies, so much for joining us.
Absolutely.
Thank you.
Okay, and Dr. Auslander, can you introduce yourself and let us know who you are and what you do and where you practice?
Sure. My name is Beth Auslander, and I am the mental health director for the Teen Health Center, which, if you don't know, is a school-based health clinic with free medical and mental health care in the Galveston schools. And I'm also a psychologist and professor in the Department of Pediatrics at UTMB. My focus has really been on promoting adolescent and child health. I'm also the parent of an adolescent. And when I told him I was coming on here to talk about this topic, he goes, "Oh no." So hopefully it goes well.
I'm sure it'll be great. We don't embarrass our children at all, I'm sure.
No.
How old is he?
14.
Okay. So you are right in the midst of it. I have two almost 12-year-olds, so we're about.
Oh, okay, awesome.
We're kind of there too. Dr. Calisans, thank you so much for joining us.
Absolutely. My name is Emily Calisans. I am one of the OB-GYNs at the UTMB CBC clinic. My clinic is specifically located in Friendswood, but I am part of the group of 7 physicians that encompass the Clear Lake campus and the Friendswood clinic as well.
Awesome. Well, thank you so much for taking the time today. And we're just going to dive right in. So Dr. Calisans, we'll start with you.
Okay.
When should we start talking about this puberty thing? What age is there a magical age for kids?
That's a really good question. And I don't think there's a set age, but in general, and this is actually a little bit earlier than I think a lot of moms realize, is that we actually recommend already seeing teenagers starting around 13 to 15 years old for kind of just a general OB-GYN visit. And that is really mostly to start these conversations about puberty, what to expect as you go through these changes. And that way they are established with someone that they feel comfortable with, that's familiar, that they can talk about everything. Understand too that it's not going to the gynecologist and having a pelvic exam right away.
Mm-hmm. Yeah. So is there, before they go have their first visit at age 13, is there an age that you start, kind of bringing these things up to your kids? Because I know I've had some conversations with I have a boy and a girl, my own little social experiment, but I started having conversations with especially my daughter, just kind of preparing her because her friends are already going through it, right? At 11.
Absolutely. And in terms of age, usually we recommend starting the conversation already around 10 or 11 years old, because usually we consider puberty as starting. It's usually around 11 or 12 years old, they first start to notice sort of early breast development. And then you can typically expect the onset of menstrual cycle about 2 years, give or take, after that. And so a lot of it too depends on sort of how each child is developing also.
Mm-hmm. I think that's really important, and start those conversations early, right? Because then it's not quite as uncomfortable. I mean, there's still going to be some discomfort, but how detailed do you think we should get when we're broaching these topics with our kids?
I think it depends on how comfortable or open, I should say, kids are, because if it's one of those you start bringing up certain keywords and they run the other direction in another room, then you probably don't want to overload them. But I think there's lots of really good YouTube videos that kind of make it a little bit funny and less uncomfortable to talk about you feel these mood changes, that's normal. You feel like you might look a little bit different than some of your classmates, that's normal. Or, lastly, even just the growth spurt that happens, that's kind of a big thing too. And very often young girls go through those growth spurts a little bit earlier. And so sometimes they can feel a little bit insecure about that. And so starting to approach some of that and just kind of say, oh, that's normal, and try to find either like certain books out there, or like I said, I think there's some really fun YouTube videos that can kind of not make it like take it lightly, but at the same time find it less of a sensitive subject, I guess.
Right. Kind of bring in a little levity into the situation. We kind of joke around here. My daughter almost uses like the hormone excuse. She's like, I'm in a bad mood because of my hormones. Like,
yeah,
like,
PMS.
Whatever. I mean,
yeah.
Or you just are in a really bad mood.
Yeah.
So, Dr. Oslander, besides these physical changes that we were speaking to, what can parents expect from that behavior standpoint? And then also, like, what are some stressors that might accompany, puberty and adolescence?
Well, our teenagers and our preteens, they want to be normal. They want to fit in. So that's part of the stressor is are these changes for me? Are they in line with what others are experiencing? I know my son had some questions about that, and I answered that there's this big range of normal. And we can also talk with your doctor about that, just to sort of see if to help reassure you on that. So there was that. In terms of other stressors that kids are experiencing during this period of time, is the academic stressors and relationships. They're all learning how to be in relationships, and so they're all sort of juggling. Well, how do I actually manage these little conflicts and so forth? And so there's sort of those relational stressors as well, and even our parent and adolescent stressors at that time.
Right. What kind of resources would you recommend to parents as it relates to, especially the societal pressures and all of the things that our kids are going through, state testing currently? I mean, everything that's happening.
What kind of resources? I love this book right here. I'll show it to you guys. Is is it not going to come out? Okay, You and Your Adolescent.
Okay.
The Essential Guide for ages 10 to 25 by Lawrence Steinberg. And it's this really great book that covers all those topics that you want to go over, from sexuality to substance use to romantic relationships to relationships in general to managing conflicts at home. All of those are wrapped up right in here. And so I find that to be a really good resource. There's a lot of good resources on the American Academy of Pediatrics and the Society of Adolescent Health and Medicine.
Perfect. I love that book title. In 10 to 25, our job is never over, y'all.
No, it's not.
I mean, true. That's quite a span. Dr. Calisans, from we kind of mentioned different ways that we can talk to our children. How do you kind of address, or how would you recommend parents addressing puberty at maybe, let's say, their annual checkup? Are there certain questions that we should be asking or that we should encourage our child to ask when we go for those regular doctor visits?
That's a good question. I think a lot of it is asking your child, have you noticed anything that seems different, or anything that makes you feel uncomfortable, or do you have any questions that, to me as the parent? And then if you don't know as a parent, so what, this actually is a great thing, let's bring it up with either the pediatrician, or if you decide to already have them see an OBGYN, say, let's talk about this. And I think it's really important too to emphasize that so many aspects are normal, and kind of to echo what Dr. Oslander said, that teenagers especially, they just want to be normal, or feel like they're part of a group and feel like they're part of something. And so I think the hardest part is just opening up that door to have that conversation. And so sometimes, most of the time we don't really see that many teenagers, even though, ACOG recommends, establishing care already around 13 to 15 years old. Also, at the same time, if your child is comfortable with a specific pediatrician and they say, gosh, I noticed this, I don't, is this, okay, say, oh, well, you've known, Dr. Smith for years. Let's, that's a great thing. Let's bring that up and ask them.
Such a good point. And that's something we always stress on these videos. It always goes back to your primary care relationship, and making sure you have that established care. So that way, if something is going on, they know you feel comfortable in bringing it up, and then you can be referred out if you need to see someone like yourself, or ready to kind of establish that care, or a psychologist, obviously, those specialists that you need to get in front of. And I will tell you, we taped a video a couple of months ago on adolescent gynecology. So I'll make sure to drop those notes, that video below as well. So if you missed that one, that's a great one to go back so you know what to expect kind of from that visit, and all of those recommendations. So I'll make sure to drop that. And kind of
can I give an example of
yeah.
Can I jump in and give an example of something that happened with my own son coming out of school, and I noticed he wasn't himself and he was looking a little down, and he mentioned that he had started he was having some acne and he was getting some teasing about that and how to manage that. So first, we were like reflected his feelings of, yeah, that's tough to hear that. And what did you say? How did you respond? What are your options for responding in that moment? And then, what, maybe we can even problem solve this. What if we talk with your doctor about what you could do to help with some of that acne? So that's how you sort of take some of that, address some of those stresses that we were talking about earlier, and bring in extra help from your primary care provider.
That's such a great tip. And obviously, acne and, all the other things that encompass, but that can be such a, I think, isolating time for our teenagers, when they're kind of going through all those. I remember when I went through it, I mean, just the breakouts, and you're already feeling like a self-conscious, like gay person.
Yeah.
And then you're breaking out all over the place.
Mm-hmm.
So I know you work in the schools. You mentioned that earlier. Can you kind of speak to what schools are doing to address puberty in the schools? Are they addressing it? Are there programs? What's happening there?
Sure. I work mainly in the Galveston schools, so I can speak mostly for that. We have a program called the 4R program. It's a program that was developed by researchers in Canada, and some of our UTMB Center of Violence and Prevention folks brought it down here to Galveston, and actually not just Galveston, but the neighboring communities. And this is actually a violence prevention program, but it encompasses a lot of the things that we want to teach kids about, a variety of topics, things like substance abuse, violence prevention, but also human development and sexual health. And so there's a whole unit on that topic, and parents are given information about that before kids start on that topic, so that they know what's going to be discussed. And what they teach are things like romantic relationships, sexually transmitted infections, communication strategies, not negotiation for abstinence and condom use and contraception. It teaches all these types of topics to really help make sure that we're teaching kids values and responsible decision making throughout, so that they are prepared when they're in that moment.
Okay. Who's typically guiding those conversations? Is a psychologist like yourself, or who's doing that program?
So the teacher is trained to deliver the program, so they attend a special training on it and deliver it. And for kids whose parents don't want them in it, so they have a way to opt out of it. So it's, parents are given the information and the choice.
Okay. And what age does that typically start at?
So it's 7th, 8th, and 9th graders.
Okay.
It's in the so it's in the ninth at the Ball High School here. It's in leadership program and the health classes, but it's mainly taught in the 7th and 8th in the health class there.
So it sounds like it's come a long way since I was a child of the early 90s from our health PE teacher, like blushing as he's like handing us the information. So it sounds like we're doing a better job.
Right, right. We want people to be prepared so that they can have the conversation. It's not so uncomfortable, and when they deliver it, it feels natural, and it's not this taboo topic that we're talking about, and there's not shame and embarrassment around it.
And I think that's the key, is really helping remove this embarrassment and the shame, knowing that we've all been there. We're all going to go through it. And, hopefully our kids can understand that too. And thank you for the work you do in the schools. That's vitally important. So switching gears just a little bit, we're going to touch on birth control as we kind of, talk about these puberty adolescent topics. Dr. Calisans, can you kind of speak to birth control? And that's a whole other can of worms and conversations to have, right?
Yes, it very much can be. And I think what's really important is sometimes to factor in. Sometimes I don't even like necessarily using the word birth control, because I think for many parents, especially, sometimes that can have some connotations to it. And that really, in many ways, it's hormonal cycle control. Very often, that's the biggest reason why so many adolescents first get started on something, either a birth control pill, is because their acne is just to the point that they've seen the dermatologist, they're on several different topicals, or their cycles are just really heavy or really painful, that they're missing school, or they're having accidents and they're leaking through their gym clothes, and that makes them not want to do sports after school. And those are all very okay things to have happen. And that's the first thing that I always try to emphasize whenever teenagers come in with their parents. And, I understand, a lot of parents can be hesitant on putting their children on birth control. Is that the aspect? Is that why we're considering birth control? Now, of course, there is the flip side, right? That there are lots of changes in terms of personal relationships that adolescents go through. And so on the other hat, it is important to have those conversations about safe sex practices and just sort of interpersonal relationships with people too. And kind of to echo, what's going on in the schools and everything, I think, it's not just the parents, but I think having or emphasizing close friendships and relationships among peers is also really important. And that sort of peer influence can be really crucial to how adolescents continue through, junior high school and high school. More often than not, the different birth controls I have my teenagers is on as well. No, I don't want that one because my friend didn't like that one, but I want the implant because I have 5 friends that are on it. And so sometimes I think emphasizing to teenagers to talk among their friends so that they know, oh yeah, I went through this, or oh, my older, sister went through this. I think that really can help too.
Yeah. Nobody
And
wants to tell them. Yeah.
And if we educate all of our kids on these topics, then you're right, they do go to each other. They go to each other sometimes first before they come to us.
Yeah.
And so if those kids have accurate information, then we're helping get that information to them that way.
Yeah.
And it's speaking to all kids, right? So we're not just
absolutely.
We're not just speaking to the girls about birth control, but we also need to be speaking to our young men.
Absolutely.
Yeah. So what is that conversation? Sorry, a bug just flew in front of my face. What does that conversation look like? If you have a son who, hey, like, son, you could actually create life now. What does that look like?
Well, you meaning like being respectful of women? or
really
their partner, whoever their partner is that they choose.
Yeah, that they are capable of, now that they're at a certain maturity age, they're capable of creating a child or another human. And so what is their responsibility in that?
Yeah, I think I'm always talking to my son about respecting women and your responsibility, and because you would be responsible for that as well, that child as well. So you need to make this decision that not only protects you, but protects her and a potential little one. So it's about teaching him about his potential partners, right? And also teaching him about what girls go through. I taught my son about the menstrual cycles and girls going through menstrual cycles, so he's aware of that, and so he's not going to school and doing something teasing a young girl for bringing a purse and having some tampons or pads on it. So I like to give him all of that information as well, so that he's prepared in that way too.
I think that's such a great way that you put it, respecting, because that truly is what it is. And I don't know what my mother-in-law did, but my husband, when we were dating in college, he went out and bought me tampons before we were engaged. And I was like, you're amazing. I'm going to marry you because you're out here. And, that's the kind of, men I want to raise, the ones that kind of get it and, aren't saying like, well, it must be your time of the month, because that doesn't help anything. Right.
Right. I mean, it's trying to develop empathy for them too. Some of your female classmates might be going through some physical pain and with their periods, and they might need support, and they just might not feel good at times. And so, and they could potentially have accidents. And what should we do in that situation?
That's good. Give them a scenario and how they would kind of role play. Dr. Calisans, would you add anything to that?
Echo that completely. And I think, also for young men, as Dr. Auslander was saying, they're just as much responsible, and they're going to be part of it. And so as much as, I'll talk to young women about what are your goals for pregnant, when do you want to start a family? What are your aspirations? What are, what options do you want? I think those are similar conversations that you should have with young men. Is, have you thought about when is the ideal time for you to pursue, starting a family? Do you know what options are out there for you as well to protect yourself from sexually transmitted infections and unplanned pregnancies? I think it's a conversation that has to happen for both, for everyone.
Yeah, and I think that you as a parent, it's very important for you to communicate your values and when you think it's best for somebody to make that decision to have sex.
Absolutely.
I tell my son, we value education a lot, and that's one of our core values, and we value relationships. And so we would like you really to wait well off, after high school until you're in a committed relationship. And that means a mutual one that's beneficial and that you really care and love this other person. We want you to wait until then. And we want you to make sure that it's protected against STIs and unintended pregnancies.
Yeah. And the family value, I think that's a really important, so then your kids know where you stand, or, your particular views. I mean, just like if you're going to feed mostly like fruits and vegetables as opposed to high C and cookies. And so I think that's a really solid point. I know that we could probably hit on about 18 other topics under this whole puberty, adolescence, and I mean, there's so much to cover. And I know a lot of you guys out there, your heads are spinning sometimes when it comes to our teenagers. I think the comforting thing is knowing that we have providers here who can help walk you through some of that and some sort of the unknowns and, talk to your friends and all of that. But doctors, I appreciate you spending time with us today.
Thank you for having us.
Absolutely, my pleasure.
This was great. And we will pop all those links down below, along with how you can find experts like we had on today. So if you are needing to find a primary care physician, a psychologist, an OBGYN, we have all those links for you. Make sure to put them below for UTMB Health. And then next month, we will see you back here for another hot topic. Let us know below. Also, if you have any suggestions of what you'd like us to cover, we want to make